Hi, I'm Tracy of Kent Holistic Practice. I'm based in Broadstairs, Kent. I do online and in-person sessions of hypnotherapy, and a lot of people don't know I'm also a qualified life coach. So basically coaching is different to the therapy side, so it's more about setting goals. But the training I did was immediately after I did my hypnotherapy training. It was with Newcastle College, and it was very much NLP based, so that's neuro-linguistic programming for those that don't know. So coaching I don't really do as a separate thing. I just kind of have the knowledge of goal setting and focusing. So I did learn a lot from it, but I am a coach, so it's not something a lot of people know. I'm actually also a qualified life coach. So it's really about focusing on what we want rather than what we don't want. Excuse me. So I'm just going to talk briefly about what I help with regarding the hypnotherapy side of things. So most people know it helps with phobias. It helps with quitting any addiction. So it could be drugs, it could be smoking. And most people do quit in one session with me. Everyone's different, so I can't guarantee everybody will quit in one session, but I would say probably a good 90% at least do with what I work with. So there's different methods of helping people quit substance abuse of any kind, and it's related back to the past. It's not so much what they're doing now. It's like when we do hypnotherapy, it's like looking at different parts of us. So often excuse me, I might get a dry throat. So often when I work with someone, it's often related to the benefits it gave them when they were young. So it could be like their 16-year-old self, or however old they were, when they thought it was a good idea to start smoking or taking cocaine. And we communicate with that part, because that part is often no longer serving that person as an adult. It's often something they actually don't want to do. But there's that 16-year-old or whatever young age they were, often as a child, they didn't know better and it served them back then. So when people say to me something like, I'm a smoker, no, you're not a smoker. It's something you're doing. Because so many people in conflict, often smokers are in complete conflict. It's like, I hate smoking, I hate the smell of it, and there's so many negatives, things they hate, but it's that part of them when they were younger is actually taking control. Because a lot of people don't know this, but your unconscious, subconscious mind is much more powerful than your conscious mind. So often people are in a battle between the two. So their conscious thinking, logical mind is saying, well, I know this is affecting my health, it's affecting my finances. They can't really see any benefit, but it's the emotional part of their brain that they believe maybe it helps them to relax. And obviously there's nothing in a cigarette that will help you relax. It could be the breathing, or you associate the cigarette with having a break or breathing differently. Because when you breathe, when you smoke, think about how you breathe. So it might be you stop, you have a break, and you're just taking time out. So it's not actually the cigarette that's helping you at all. So when you have a cigarette, think about how you smoke. Are you breathing differently to how you normally do? So when we're stressed, we tend to breathe very quickly and our heart rate goes. So now think about how maybe when you smoke, think about it. Imagine you've got that cigarette in your hand. How are you breathing differently to when you're stressed? So are you doing this? You're exhaling longer. Now, when you exhale longer than you breathe in, this activates part of the nervous system called the parasympathetic nervous system. So when you breathe out longer, that part of your nervous system, the parasympathetic part, is relaxing. So all you have to do, so imagine you're taking a cigarette without the cigarette now, and you're breathing in, and then breathe all the way out. Just do that a few times without the cigarette and notice how you feel. Just see if you feel calmer. You should feel calmer. So just do this a few times. And an easy one to remember is called the 3-4-5 breath. So you breathe in for 3. 1, 2, 3. Hold the breath for 4. 1, 2, 3, 4. And breathe out for 5. 1, 2, 3, 4, 5. Do that a few times. Notice if you feel more relaxed just doing that without the cigarette. Okay, so just give that a go for anyone that smokes, or even those that have any addiction, whether it's sugar, because sugar's highly addictive as well. I help a lot of people with that, and it's really important to quit sugar, because when we have spikes, glucose spikes, it's really, really dangerous for our body. You know, insulin levels and so on. There's so much, you know, diabetes, and all sorts of disruptions in our body. It's really important to stop sugar spikes, because long term, I'm not going to go into all that now, but you know, this is something really to be aware of for our future health. It's not just about putting on weight or rotting teeth and disrupting our gut flora. It's so many things that sugar really is very dangerous to us. So it really is something that needs looking at for us to quit sugar, or at least cut down on sugar. And if you're going to have anything starchy, any of those starchy foods like white food that contains a lot of sugar, releases sugar very quickly, is if you're eating, a little tip to have is eat fibre first. So that could be your vegetables, then go with the protein and fats next, and then have the starchy foods. So if you have it last, those starchy foods, maybe the potatoes, and so on, if you have those last in your meal, it's going to help the sugar spikes. So that's a little tip there if you're going to have those starchy foods. And it's not about cutting them out completely. I would never suggest anyone cut out complete sugar altogether and very quickly, but it's just something to be mindful of. So I'm actually studying, I would really love to do food medicine, nutritional medicine, and it's something I research as a holistic therapist. So it's not just about the mind, I work with the body and the spirit as well. Once we combine all those things, you know, you have overall health. It's no good just looking at the physical symptoms. We need to look at what's going on in the mind, and also to reconnect with our higher self, you know, that bit more to us. It's not for everybody, I get it, but a lot of people are actually open to that. So they become more their authentic, real self and have that connection. And then also they never feel alone. A lot of people feel they're isolated in life in some way, even if they're absolutely surrounded by people. Okay, so just a very quick video, and if you would like to ask any questions, please let me know. And thank you for watching.